Double Hay, San Francisco Bay, Monterey. My name's Alexandria.
And I'm Dr. Shasta.
And we're back with another episode of Your Healthy Living
here
in lovely Campbell,
with amazing guest, Dr. Nancy Gardner, TMT, a pioneer in the field of medical thermography, offering women a safe, more accurate option for breast screening. She is board certified as a technician of medical thermography by the American College of Thermology at Auburn University. She is and has been instrumental in changing the paradigm of women's breast health in the United States with her comprehensive breast screening clinics, offering women a safe, more accurate method of breast screening without carcinogenic radiation or painful compression, as would be found with mammography. So welcome to our show.
The doctor's in the house. The doctor's in the house.
And she has her master's in nutrition also.
And I love it when we have doctors on here because it just kind of makes us... shows that we do have some really good guests.
We do.
We like to have doctors on the show.
Local. She works in the whole Bay Area, has over 4,000 patients in the Bay Area.
That's crazy.
And she will be also showing some before and afters of what she's seen, how she's given a protocol, and then the after that people can see and become enlightened to a whole new way to be monitoring their health.
And I think this is really important, to find something that's a little bit different than just bombarding your body with radiation to try and figure out if something is wrong with it that could have been caused by radiation in the first place. Just doesn't really make sense to me. So can you tell us, Doctor, is it okay if I call you Doc?
Yeah, just Nancy.
Doc, Nance? Okay.
Just call
Dr.
me
Nancy.
Nancy.
Tell us a little bit about thermography and the breast screening process, and what is it that makes this different than just your typical screening that doctors do nowadays?
Yeah, well, first of all, there's no compression or radiation. The woman stands bare-breasted in a room for 5 minutes till she acclimates, meaning the clothes have held the heat in, so I want to see her normalized.
Oh, because of the thermal thing. Okay,
yes,
that makes sense, right?
And what we should see is very symmetric thermal features throughout her breast, and so that would be like a benign reading. A Th2 would be symmetric vascular features on both breasts, and then as breast cancer develops, it gets very complex. And so a Th5 would be the rating for a breast cancer, and you'll see a complex feature setting up to feed a tumor. And when you compare it to the normal breast, it really stands out. So we rate them on a scale from 1 to 5. 1 and 2 are benign. 3 is the first sign of it not being right. And what I found is after 5 years of working with women, I was able to turn around ductal carcinoma in situ in 80% of the patients with a holistic nutritional protocol. So I do have a before and after picture of that. The picture on the left is it shows the neoangiogenic blood vessels developing around feeding the atypical cells, and then the picture on the right shows after the protocol, and it's completely gone.
So what happens is, and I'm just trying to think about this and rationalize it in my head, the blood flows to feed the cancer, which creates more heat, which is what we're measuring is the difference in the heat in the tissue.
It's not just the measurement of the heat, but yes, that's a great part of it. It's also the features that look like a spider web of veins versus one or two little veins like a lightning.
Because they kind of group into
the blood supplies like a lightning bolt in a night sky, but then they start getting complex. Neo means new, angio means created, genesis.
Oh, really?
Neoangiogenesis is a new blood supply that develops specifically around feeding a tumor, and we can see that real clear.
And that's what cancer is. You have to have those blood cells to feed that tumor.
You have to have atypical cells first. Those are cells that are sitting around with dysfunctional DNA trying to reproduce. Okay, you have to have that first. And surprisingly enough, 40% of us women have that, and that's from post-mortem research, meaning people have died from car wrecks or whatever, and they go in and do autopsies. So we have a lot of that, and that comes from us not sleeping well, being under stress, and our bodies aren't cleaning those things out. Our immune system isn't strong enough.
Or like we were talking about at the beginning of the show, the toxicity that we're all just inhaling and washing our bodies with, absorbing through our skin.
Yes, exactly.
Wow.
Exactly.
And the estrogens and
from
organochlorides from the plastics.
Yes, exactly.
And the growth hormones and the pest antibiotics that are in the animal products and in the genetically modified food, especially wheat, that they put a Bt toxin inside of the wheat that grows to kill split the bug's belly. We are now eating that. Third generation mice are completely infertile. And all of that is impacting our immune system.
I always used to think I was the smartest one in the room. I'm feeling a little inadequate right now.
Well,
but
I always help my patients
No, and I
detoxify.
get what you're saying. I mean, if you think about it, if the bugs won't eat it, or it kills the bugs.
It splits their stomach.
What's
What
it
is
gonna
it
do
doing
to
to
our
us?
tummies?
What is
Yeah.
it doing to us? So, this was my first question when we were kind of, talking to you before the show was, okay, this is great. This sounds really cool. We don't have any radiation. But how accurate is it? I mean,
Well, the Marseille classification was a case study that followed 3,000 women through a 5-year period, and they took the images and compared to see who ended up with breast cancer, and that's where we got our TH1 through TH5 rating.
Okay.
And that came up with a 9% error rate, meaning 9% of the time they missed it.
that sounds pretty accurate for what
That
I
sounds-
understand.
Yeah, that's very
from-
low because a mammogram is like 40%. And
Really?
Yeah, and
Wow.
that's for a postmenopausal where her breasts are kind of soft. If you get the younger women or women who haven't had children and they have very dense breasts, a mammogram has a 60% error rate. And they're
No kidding.
telling women you have to come back in for more radiation because we
Right.
can't see it.
Right.
But they can't see it when they come back in either.
Right.
So it's not an accurate tool.
So there are a lot of false positives.
And they're radiating their breasts a lot more than they should, which would also has an accumulative effect. Dr. John Goffman, who was the head of radiology at UC Berkeley, did a research project, and he said 3/4 of the incident of breast cancer in the United States is caused from earlier ionizing radiation.
No way.
Yep,
Wow.
primarily
Oh my
from
gosh.
medical sources.
You know,
yes.
I always thought that when I was a kid, and I was getting an X-ray for a bone or something. They made me put this big old heavy lead thing over my lap, and I'm thinking,
Yeah,
what's
that's
this for?
because we want you to be fertile and have lots
Oh
of
my
children. You
God.
better not be radiating.
Well, I know there's one of my children over there directing the show right
yes.
now,
You
so
must have been
obviously
okay.
it covered me anyway. But no, this is just kind of blows my mind how the medical community just kind of continues to do these types of. I mean, we live in an age where you can send a video signal through the air to a beautiful TV and have it look almost better than it does in person. Why aren't they using more of this on the medical side of it?
Well, they're really bought into radiology. I mean, they have a lot of equipment.
Oh,
Ultimately,
there you
when
go.
they
It's a
do
money
this,
thing. That makes
ultimately
sense.
when they do the surgery, they do need to use an X-ray machine to find the lump and to know to do 2 wires and crisscross where the lump is. Because I used to be a surgical nurse. I studied at Stanford, so I know when you go in there, it isn't like this big ugly black thing that you go in and you go, oh well, that's the bad thing.
Right, that's
Take
what
it
I
out.
thought it was.
No, it's all the tissue. It's really hard to tell the difference just eyeballing it. So they look at it through the radiation and see and crisscross 2 wires, and then they get clean margins in a sentinel node biopsy where they put dye directly into the tumor and see which lymph nodes are involved and take those out. And if they're clean, then they don't need to do chemo. Chemo's contraindicated if there's no lymph involvement.
Wow.
So do you
So-
have many patients who come in after having had breast cancer surgery and just to see what's going on with the vascularity in their body? and the
Yes,
breast?
that and women because they've had augmentation or reconstructive surgery and they don't want to do a mammogram and smash the augmentation appliance and rupture it. So things like that. Yes, and
And you were saying insurance covers for
yes.
thermography now?
Yes,
And
insurance is better.
who can order that? Can you order that through their insurance?
They don't have to. You generally speaking, it doesn't even have to be ordered.
So a
from-
patient
Really?
can come pay you, get a receipt from you, and
a
submit
super
it to
bill
their
with
a
the
super bill,
insurance codes.
and submit it to their
Not
insurance.
all of them, but a good portion of them are handling it,
it-
including Medicare.
It is very much now being paid for in America.
Covered, yes.
That's wonderful.
Yes.
Great.
Wow, I had no idea, and because I mean I kind of heard of this in other realms, but I didn't know it sounds to me you have enough patients here in the Bay Area
yes.
that it's becoming fairly common.
It is. It is.
Huh. So even insurances, even Medicaid is covering
Medicare.
some
Medicare.
Medicare.
Yeah,
I'm still trying to figure out the
that's
difference
for us
between Medicaid and
older
Medicare.
people. You don't know yet.
No, I'm
You'll
not
be
there.
there
I'm close.
soon.
I am getting there. In fact, I want to, and we're going to talk about this in the next segment, but I'm kind of interested because you can do actually a full
whole
body
Yes,
type of thing.
full
And
body
I
scan.
guess that's for males too, right?
Oh yes,
Yeah.
absolutely.
Yeah, I'm I tell you what, we're gonna talk about that after the show and whenever, because I want to get that done. But great stuff. We're gonna be right back after this message, and with Dr. Nancy. So stay tuned.
I do traditional Chinese medicine, and that includes 5 different branches: acupuncture, massage, yoga, tai chi, qigong, herbal medicine, and nutrition. It is amazing in helping the body heal itself, that it releases the body's natural endorphins, serotonin, and seems to rebalance the hormones of the body.
Lower back pain was taken care of very quickly. 6 treatments and I was pain-free. And this was like 3 years ago and I've remained pain-free.
I've grown up in the Bay Area, and I have had my own practice for over 15 years. When I was 12, I decided I want to be an acupuncturist, and by the time I was 25, I was licensed.
I have thyroid condition and stress, big time. When I walk out, I'm feeling like a whole different person. It's definitely a blessing to be able to come here.
I love helping women have babies, and the day that they actually get pregnant, the look in their eye is like, it's the best thing ever.
I've been struggling trying to get pregnant for the past 3 or 4 years. I came to Shasta. I would totally recommend her to anyone out there that is trying to get pregnant. She will do great for you.
Way of wellness has to do with living a life that keeps us well.
Hi there, this is Alexander with It's All About the Show. You know, I've been with Money Concepts since 1994, and they have been the primary catalyst for my success as a financial advisor. If you're looking for a career change and you want to help people for a living, check out moneyconcepts.com/ALEE or call 946-8378 today.
Hey, double hey, San Francisco Bay, Monterey. My name's Alexander.
And I'm Dr. Shasta.
And we're back with Your Healthy Living and having a great time learning about this. How new is this technology, by the way?
Oh, it's been around for as long as mammograms.
No kidding.
Yes, absolutely.
And with the accuracy that it has, they ended up going to the radiology side.
It's a lot more work than a mammo than
Oh, it is.
Oh, yeah,
Oh,
to do the
okay.
reports.
It's
very detailed.
Okay, I see. So the radiation just kind of goes, oops, poop, hey, there it is.
Or they miss it.
Or they miss it.
40% of the time.
Yeah,
on
that's
that
right.
part.
Oh, there it is, or there it could be. I don't know. Who knows?
And I remember a couple of years ago they were saying that the 40% positive with mammography.
80% positive. False positive.
False positives.
They're getting better now because they're using the ultrasound. An ultrasound will see if it's fluid-filled and it's pus and an infection versus solid-filled, and what the margins look like if they're merging into surrounding tissue. We know it's probably more suspicious. So, yeah,
And
they're
with
backing
you,
up
it's like
with that more.
9%.
Yes, it's 9%.
That's wonderful. So
For
that's
both false positive and false
that's
negative.
a big difference.
Yeah, it
That
sure
is. It's huge.
Yeah.
Yes.
So everybody
it's
should
just-
do this every year.
mean-
and what makes you different? Like, what makes your exam
different than everybody else? Well, number
Yes.
one, I've been doing it for almost 30 years. I've been doing thermography, so I have a lot of experience. I used to be a surgical nurse. I actually do a breast exam, and I don't know of anybody else who even touches the breasts, which is a very important part. Teaching the patient what's normal, what's suspicious, helping them become more user-friendly on their own breasts. And also I go over the results in detail, and that's included. If we ever find something, I do free counseling for them and walk them through all their procedures. If they need an ultrasound, interpreting what that means and what the next step is. And I don't just let the doctors do whatever they want with my patients. I watch them through everything so they're making informed decisions.
and you give them a nutrition and supplement protocol?
Yes, absolutely. And, if I have research that I did, was presented at Auburn University on protocols reversing ductal carcinoma, and 80% of my patients came back with totally normal, benign readings. And so dealing with what we were talking about earlier of all the toxic chemicals, how it affects the liver and the different organs, which are taking your T cells and B cells to fight infection. So we boot up their immune system, get their stress factors down, and turn it around.
So you give them healthy, natural ways to help heal themselves.
Yes, exactly.
So in essence, they wouldn't really even need to get an X-ray or be irradiated until and if they need to go to the table and have something removed.
If there's something that is, sometimes people come to me really late. It's too late for me to do anything about it, and we need to move forward with that, and I'll walk them through all those procedures and get it handled and explain to them that, if there's no lymph involvement, chemo's contraindicated, meaning you don't have to do chemo, and that usually puts their mind at rest. You just take that little puppy out, take the little lump out, and work on your immune system. So.
Now, it's as far as this, I kind of was excited about this whole body scan thing.
Yeah.
I wanted to kind of run back to that. So what can that tell me? I mean, I'm just envisioning myself as this, kind of that guy that you see in the doctor's office with all his muscles borne out, standing there with his hands out and stuff. What is it that you can find? I mean, you find cysts or tumors,
to start off with, some of the things that I do with people are case studies from specific research. My PhD is in clinical research, so I'm very interested in looking at everything everybody else has ever done with thermography and what the results are. So I can look at your eyes, just take one picture of your face, and the level of stenosis of your carotid artery and predisposition to stroke, I can see by measuring the difference in temperature of your ophthalmic artery, which is your first cerebral branch. That's the blood flow going to your brain. And I can tell you how clogged up it is and then put you on a protocol to reverse that. And I do get really good results with the protocol. Looking at your hands and your feet, the temperature of your hands reflect the blood flow from the heart out to your extremities and the feet from the extremities back to the heart.
Okay, that makes sense.
So, so basically you're naked in the room, and I'm taking pictures that I let you cool off after the warmth of your clothes holding your heat in. And then take pictures from head to toe, front and back. I can see infections in your teeth, how the thyroid's functioning. Chest, breast area, under the arms, axillary lymphatic congestion, subluxations of spinal vertebrae, kidneys, how the kidneys are working, how the liver, the gut, all the intestines, dysbiotic conditions of the gut, varicose veins.
Would that include like leaky gut type thing? I mean, because that's inflammation, and I got to guess that's hotter than everything else.
It's very obvious, and we can see all the different organs. Like one person came in and I said, "Oh, your pancreas is really lit up," and sure enough, she was trying to figure out why she was so sick, and the doctors didn't even notice that she had an inflammation in her pancreas, which is a big deal because that's where all your digestive enzymes are coming from. And
pancreatic cancer is just terrible.
Well, and it's from drinking too much coffee.
Oh, great.
Yes. 1 cup a day, back
Daughter's
off.
looking at me, Dad, you got to last a little longer here.
Yeah.
I usually only have about 2 or 3 cups a day, though.
That's a lot.
It is?
Yes, it is.
I used to drink a pot a day. I thought that was a lot.
Yeah, that is too.
Oops.
So
I
like
guess it's time to cleanse.
like leukemia, what might you see with leukemia?
Well, I'm not going to say that I can diagnose things like that.
No, you don't diagnose.
It's not within this.
No, you don't
but
diagnose.
I can see when the
what
lymphatic.
might you see?
I can see the lymphatic system lit up. That's all I can say.
Yeah.
The thing is, nothing outside of a biopsy is going to tell you 100%. So I can tell you with this picture and what I'm looking at, the percentage of risk factor for that.
So you can direct somebody down the path to say, hey, we need to take a look at this. So
very much so.
Why isn't a scan like this just standard procedure and a checkup? I mean,
well, it's a lot
know
better than, for example, a couple of patients that came in chose to do this instead of doing a colonoscopy, where they're going to go all the way up inside because there's a lot of chance that they could perforate the colon, and it's dangerous and harmful. And the nice thing about it, you guys all both asked, what do I do that's different? I sit down with the patient. They'll get a 3-page written report with the colored images, and I'll sit down for 40 minutes on the phone with them and talk to them about every single picture, what it means, and put together a protocol and email a comprehensive protocol to reverse all the different things that are within the scope of my practice to work with. And anything that's outside the scope, I will refer them to a practitioner. And I usually do refer a lot to acupuncturists because they can do your pulses and look at your liver, lungs, kidneys, skin, on everything, what's working, what's not working, and boot up that balance of what you need balanced in your body. Most people are out of balance.
I think, most of us are. That's why there's so much sickness in the world too. You know, I mean, it's a thing about balance, and balance to me means 1 cup of coffee a day.
Yes, there you go. So you can stick around and not have burnt out adrenals, which leads to heart disease, which leads to no more daddy, which is not good.
No, we're not going to do that. My dad's 90 and he's still working out, and he's doing a marathon.
Goodness.
He's doing
Good
a marathon
genes.
coming up. So, one thing I did want to touch on, we're getting a little close to the end here, but I wanted to talk about your books, Staying Healthy in a Toxic World. And you can see the book at the website, www.stayinghealthyinatoxicworld.com, correct?
No.
Breasts.
I thought that was the website.
No, it's Healthy Breasts, plural on the breast.info is my website.
Okay,
and
.info.
on that is under products, you'll see the 2 books. One is Staying Healthy in a Toxic World, a self-help guide to cellular detoxification. And we talk about how to cleanse the liver, lungs, kidney, skin, colon, and lymphatic system, all self-help therapies that you could do at home.
Oh, that's great.
Yeah,
That's
and it
great.
also tells you symptoms and ways to tell how each of the organs are functioning, so you can tell which organs need the most help by how your body is responding. You can just read it and you'll know how to take care of yourself.
See, and I've always thought, God put this on the planet, whatever you want to believe, but we're here to live naturally, you know?
As closely as possible.
Right, and we're putting all this unnatural stuff into our bodies, and of course our body's going, what the heck is this stuff?
Exactly.
Yeah.
And
Doesn't
it's not
understand it.
even, I mean, you can completely understand why we're in this situation.
Yes.
70% of Americans are suffering from treatable, preventable diseases.
Yep. And that's one of the reasons KOYS and Your Healthy Living is here. Because
Yes,
kindness in your
thank
soul
you.
helps people with self, health, and wealth.
Yes.
Thank you so much,
Thank you for
Nancy.
being on the
Appreciate it.
show.
You can reach her at 209-881-3044.
Yes.
We're going to see you next week on Your Healthy Living Show. Don't forget to tune in to KIYSradio.com and check out all of our shows, all of the fun stuff that we do, and our special charity of the month that we got. So thanks for joining us. Have a great week.
Bye.
Take care. Bye-bye.